Welcome back to Contours, your weekly roundup of what's happening in the WNTI listening area and the surrounding communities. I'm Melanie Teal, and joining me in the studios this morning is John Hampelos from Little Brook Nursing and Convalescent Home, and they're located in Califon, New Jersey. And John comes to the station periodically to let us know about things that you need to do that focus on senior care and ways to plan ahead for your own senior living. And today we're going to talk about the 3 signs that it may be time to leave your assisted living.
Good
Welcome,
morning, Mel.
John.
Good morning, and thank you again for the invitation.
So I never thought about this topic. You know, you go to an assisted living, you know, maybe you started out in a 55 or older community, then you move into the next step of it. But beyond that, I never really thought much about it.
Yeah. And we all haven't. Assisted livings, you know, as a global term, is a relatively new type of phenomenon, which has developed over the past, I would say, 30 to 40 years. Prior to this, the elderly really didn't have these types of facilities, but over the years, there have been a number of different levels of care, we'll call them, that have come into formation to accommodate the growing needs of an aging population. And assisted livings have a place in our society.
You see them popping up all over the place.
They do. And you see major hotel chains look at this as an opportunity for them to extend their hospitality industry to an aging population. But we have to be a little careful with how we perceive these types of living arrangements. When I say assisted livings, these could be multi-bedroom houses to 50-plus apartment type of residences that are run by the Marriott or other types of hotels in the industry.
Now, I didn't even know that hotel chains were getting into the assisted living business. That's
they're
news
getting
to me.
in, and some of them are getting out because of the liability associated with this. And this is really what I want to speak to today.
Okay.
Assisted livings, whether they're home residences or assisted living facilities or retirement communities, are not what we call high-skilled nursing homes. Little Brook Nursing Home is a high-skilled nursing home. It provides all the needs that a resident has daily, whether it's bathing or eating or toileting or medical, social activities, physical activities, etc. The catch-all assisted livings may not be able to provide these types of cares, not willing to provide them, ill-equipped to provide them, or just not licensed to provide them. And we as consumers of this type of care have to be very careful about what the definition of a nursing home is. These types of assisted living serve a purpose in our society. They provide for the needs of seniors to a limit. But when a senior starts to require more assistance, starts to fall, becomes disheveled and unkept in these facilities, then it's time to consider a move to what we call a true high-skilled nursing home. And this is really critical for the sustenance, the maintenance of the end of life quality of care for the end of life individual. And I know that some of the assisted livings provide for aids, but these aids are not like the aides in a nursing home facility, for example.
Right.
Home health aides are not trained and certified to provide a safe environment, for example, and effective care and comprehensive care. Home health care aides provide some assistance to our seniors, but when it comes to receiving certified, safe, effective, and comprehensive care, this is where a nursing home is important and critical. What we're talking here is for a senior citizen who needs a higher level of care to help them eat, to help them get up in the morning, to help them dress, to help them bathe, to wash up, to prepare for the day, to help them exercise, get some activity, to become involved in social activities, to help them throughout the entire day, not just 1 or 2 hours a day, but 24/7. And that includes medical and nursing care. And so that's what differentiates a licensed, skilled nursing home from the assisted livings.
And you may only need the assisted living for an amount of time, and that might be all you ever need.
That's right.
But there are times when you have to move beyond that.
That's right. That's right. And approximately 1% of the population does need that type of higher level of care at some point in their lives. Now, in the U.S., there are 1.7 million beds that are nursing home beds that provide full coverage care. That isn't enough, and that's regulated by the federal and state governments. And that's why assisted livings have played a role in assisting the aging population. But at some point in time, when a person begins to fall, when they're not eating well, when they're not taking or being given their medications properly, when that time comes, it's time to consider a nursing home. And to consider a nursing home before the money's run out. And I want to get to the second point here, because what complicates matters here even further is that some assisted livings may ask your loved one or the person for whom you're responsible to move out of their facility, because assisted livings may not be Medicaid approved and may not accept Medicaid payments.
Oh.
So when a person's personal assets run out, these facilities may ask that resident to leave and move back into their home with their family or friends. And that is very difficult, because at that point, many of these people require a higher level of care that the assisted living has been unable to provide and cannot provide, is not licensed to provide either in many cases.
Oh, sure. I mean, I could not imagine, as much as I love the elder relatives in my life, having them come to live with me. Now, if I had the means to do it, bring them on. But
Right.
I know I don't.
Right.
My house isn't set up for it. I have too many stairs, and nobody's there during the day.
Right. The cost
no
of
one's
care
home.
is excessive. To have a full-time 24/7 around the clock care for our loved ones would be in excess of $200,000 a year.
Mm-hmm.
That's a lot of money. A lot of money. And so we propose that before a person begins to fall, before they present with a need for greater amount of care, before their resources run out, that 6 months to a year before they run out of money and before they get caught in that situation, that complicated situation where they're being asked to leave, that the families who are responsible for that resident, or the power of attorney for medical decisions and financial decisions, for example, sits down and begins to evaluate what options they have as far as assisting that resident with placement in a nursing home like Little Brook Nursing Home. And so we encourage residents who are in assisted living facilities and their families and friends and professionals to discuss their needs, evaluate, especially with their physician, evaluate their status, their medical status, and determine whether it's time to move on before it's too late. Because the last thing we want to see is someone falls, breaks a hip, ends up in the hospital, and then has no resources to accommodate them. And then they're at the mercy of the state.
Exactly. And there are many county-run facilities that you hear every day, like the state or the county doesn't want to have that responsibility of having that nursing home anymore, so they try to sell it to a privately run organization.
Right. And that happens very often throughout the country. In addition, many of these county-run facilities are overwhelmed. They are full to capacity and have a long list of people that are waiting to enter into that facility. And so the potential resident is caught in a situation where they have nowhere to reside. And it's a very, very sad circumstance. And so we encourage people who are responsible for the aging resident to look at what their options are in the community, to reach out to the nursing homes to begin discussing what those options are, so that 6 months to 1 year prior to the depletion of their resources, they begin to make contact and transfer the resident from an assisted living facility, which is not able to provide the care and for the needs of the resident, to transfer that resident from such a facility into another facility that can provide for the care at a reasonable cost. And I'll come to cost in a moment, in advance of greater needs that are sure to come as we all age. There are 3 signs that it's time to move from an assisted living situation that I wanted to discuss this morning, Mel.
That sounds good. I mean, because we might not know what to look for.
Exactly. And the first sign that it's time to move on is when the care that's being provided does not meet the needs of the resident. Specifically, there are 3 types of areas that we should all be looking at. And number 1 is the care coordinated and tailored to the resident's need? Or is everybody getting the same type of meal or the same type of shower activity where one may need a bath and it's just not tailored to them? Or they're all being dressed in very similar clothing, or they're not having activities or kind of just standard activities that are not really involving the resident. The coordination of care is critical. Everybody is different. You're different. I'm different. We all have different needs. I may have a condition or a disease that someone else does not have, or someone else has other diseases or conditions. And so all of our needs have to be tailored. And that includes dressing, bathing, eating, what kind of food you like, social activities you want to be involved in and what you don't want to be involved in. Not everybody likes to play chess, and not everybody likes to play bingo. Moving around safely throughout the home, having assistance to move around instead of being situated in a room or sitting in the bed all day long. Living in a comfortable environment, being able to stay in a well-heated facility or an air-conditioned facility, or wanting to go outside and sit on a patio or go out to the deck or take a little walk on a pathway. So everybody's conditions are different. Everybody's needs, I meant to say, are different. And so care must be tailored to everybody's personal needs. The second point related to care not meeting needs is that our health has to be monitored. Now, we know that assisted livings do not provide much health care. That's just not their role or license to do so. Mm-hmm. That is not their license to do so. That's why they don't have a medical director on staff. That's why they don't have a nurse on staff 24/7, or certified nurses' aides for that matter. And so what's important here is around the clock healthcare coverage, so that if a person is having a pain in the middle of the night, or if they have diabetes and they need to have their sugar levels monitored several times a day, there's someone on staff that can help and assist them with that. One of the things that's a telltale sign that a person needs to leave an assisted living and go into a high-skill facility is that they're in and out of hospitals all the time, even for minor things.
I didn't even think about that.
Yep. Even for minor infections or, pains or things like that, falls, tripping, so on and so forth. This is a telltale sign that a person needs to have greater medical coverage and care. And so we encourage people to be on the lookout for that type of need. And the last, which is as important as the first and the second in the care not meeting needs, is that a person in that age bracket that needs greater care is usually on many medications, at least 2 and up to 8 and 10 medications per day.
True.
Per day, multiple times per day. The assisted livings are not required to have certified nurses' aides. They're required to have a medication aide to administer medications. But a licensed skilled nursing home is required to have licensed nurses with extensive training in healthcare, in nursing, and in medicine, and in dispensing medications that will give out the right dose of the right medication to the right resident at the right time. Those three rights, the right dose, the right medication, the right time to the right resident, is critical, because no one should be under-medicated or over-medicated or mismedicated. It could mean the difference between life and death.
Absolutely.
And it could mean, if not life and death, a person tripping because they're taking the wrong medication and it lowers their blood pressure, or it's a narcotic or whatever. And so, and there are toxicity issues too. And that's why bottles have explicit directions that must be followed. Medical bottles, medicine bottles have the explicit directions that must be followed by a trained healthcare professional. And that's what separates, another thing that separates a licensed skilled nursing home like Little Brook Nursing Home from an assisted living facility. And so we encourage people to be aware of care not meeting the needs. That's number one. Sign number two is steadily increasing fees. Now, we know that there are normal and customary increases in fees year on year.
Sure.
For inflation, et cetera. But when the fees begin to exceed the care that's being provided and becomes excessive, then it's time to start looking for a true high-skilled nursing home, licensed high-skilled nursing home. And you'll notice that when your fees, begin to approach and exceed $6,000 per month, because at that point, you're beginning to pay for nursing home rates.
And they're not getting the same care that they would if they were in a nursing home.
Right, the
But
same
you're paying
high
the
level
same amount of money.
or quality of care at that. Exactly. So when you start to see that, it's time to determine whether the licensed skilled nursing home is a better option than an assisted living. And again, before the money's run out, at least 6 months, preferably a year in advance of money running out. And so we encourage people to be very, to monitor the expenses very closely, look at the bills every month, and even challenge some of them. Because having an aide assisting a resident doesn't guarantee you that it's a certified and well-trained aide to provide, again, safe, effective, and comprehensive care. And those are three important elements in the care that aides provide. Again, trained and certified to provide safe, effective, and comprehensive care. There's one more sign that's, really quite disturbing in this industry of assisting the aged, and that is when families or individuals are asked to hand over their entire wealth to a facility so that they can, quote unquote, age in place. That is, they would never have to move from where they're receiving their care. And if your loved one is asked to commit everything, don't ever, ever allow that to happen, because life, you never know where life takes us. If a person is unhappy, if a resident's unhappy, they may not be able to leave that situation. If they're not receiving the quality care that you or your loved one expects, they may not be able to change your situation. And also, when your resources, when your monies are tied down and encumbered, if, heaven forbid, another Hurricane Sandy comes through and takes out the facility, disables it for months on end,
where do you go?
Where do you go? You have no options. Your home, your assets, your monies, your stocks and bonds, jewelries, cars have already been requisitioned. And so be leery about these kind of requests and requirements. Don't sign any documents unless you've discussed it with your family and an attorney. So sign number 3, beware if you're asked to hand over your entire wealth. Our assisted living serve needs of able, not quote unquote, able seniors to a limit. But when the seniors' needs increase and their fees start rapidly escalating, be sure to get the best certified care for that money. And so look to a high-skilled nursing home facility for that type of care.
John, once again, you always bring us so much good information for the listeners to think about. And to think about at any age. We all have aging relatives, friends. We may be starting to get over that cusp where we're thinking about these things for ourselves. It's like you say, it's never too early to plan for it. So I appreciate all the information that you brought to us today for this segment. And thank you. And again, how can folks get in touch with Littlebrook Nursing and Convalescent Home if they'd like to get on your newsletter, or if they'd like some more information about the facility?
Sure. We welcome calls from everybody in the community. And the way to do that is to contact our administrator, Mr. John Casarda. And John is available at Littlebrook Nursing Home practically 24/7. If it's very, very urgent, he will return your call quickly. He can be reached at 908-832-2220. Again, 908-832-2220. And Littlebrook Nursing Home is located in beautiful California, New Jersey.
John, thanks again.
Thank you, Mel.